Introducing Mark Blatt, MD, Bryan University Health Informatics Advisory Board, Worldwide Medical Director, Intel Corporation. Intel is a major worldwide developer of healthcare delivery systems.
Intel became involved in health informatics, believe it or not, from a very altruistic point of view, wanting to do good and make a difference in the world with the technology that Intel actually brings to other industries. Back around, I believe it was 97, 98, Andy Grove was Time Man of the Year and also developed prostate cancer. He developed it in a very public manner. Andy was our leader at the time, beloved through the company, and he asked us to look at how we could use technology to improve what was happening to him and therefore benefit the world. Information technology actually holds the promise of actually improving the quality of life and driving that not just into the developed world, but to the billions of people in the developing world. If we can make that kind of difference with that technology, I'll go out of the world happy. I'm a medical doctor by training. I had an amazing experience one Saturday morning on a 4th of July weekend. I was covering for about 15 primary care doctors. On a Saturday morning, I probably got several hundred phone calls. It was a Saturday holiday weekend. You can't send them all to the hospital or the walk-in center. Your colleagues will be a little annoyed with you. I found myself asking questions, and at the end of the 4 hours, I had probably treated about 80% of the people adequately with quality health care. About 20% needed follow-on. I started to think about this experience. I had taken care of more people in 4 hours than I usually take care of in a week. I had done it virtually in 30 to 60 seconds, extremely convenient for them, and the price point that I mentioned was virtually free. Monday morning, all of these calls get intercepted by various secretaries. You take a half a day off from work, you pay me $100, and we basically got the same outcome. I became enamored with the idea of how could we deliver quality, inexpensive health care to the masses. I knew I didn't have the training to do it. I went back to Yale, got an MBA, got hired by Intel, and that's really been my mission since then. That morning was transformational for me. The opportunities for people in health informatics today are just enormous. Health IT is growing around the world. Skyrocketing healthcare budgets are causing governments around the world to look at how they organize healthcare. Emerging markets around the world are looking at how they develop healthcare programs for their citizens. The United States is looking at how we can reorganize healthcare because our current costs are literally bankrupting our states, federal government, and companies. Citizens can't afford healthcare. I believe the only way to raise the quality of care, lower the cost, and increase access to all citizens is by taking more advantage of modern IT and modern IT infrastructure. That doesn't replace the personal nature of the relationship that you have with your caregiver. It enhances it. It's a tremendous tool for scaling and leveraging. The opportunities are enormous. The opportunities within health informatics are far broader than just thinking about writing programs or writing software. The medical device industry is dependent on information technology to connect the devices that are going to provide the care from you. You might start to see caregiver technology enter your home in unbelievable ways that communicate with your television set, that provide the ability, for instance, for you as a diabetic who with a blood sugar monitor might prick your finger, get a look at a blood sugar, have that go to your smartphone. Your smartphone knows your schedule. You show up at a restaurant, it's geolocation aware. Now using personal information, what your morning blood sugar was, what the menu at the restaurant is, it sends you a text message and recommends what you should take for your afternoon meal to have the best impact on your diabetes. And by the way, if you don't listen, it might send a message to your wife to let you know that that's not happening. Technology has many broader opportunities. Policy opportunities, the ability to actually put together sustainable systems, looking at architecture. It's too many opportunities to even mention. When you think about what you might want to do in healthcare information technology, I think you have to find what strikes a passion in you. Maybe it is policy. Maybe it's how we organize governments. Maybe it's how we pay for these systems. Maybe it's actually how we use modern technology to actually architect and deliver care differently in developed or emerging markets. Maybe it's a great idea for a medical device and how we can make it more intelligent and smarter. Maybe it's an incredible way for actually lowering the cost of delivering care to a population. Maybe it's taking advantage of genomics. There are so many different ways you can leverage your knowledge here, but the key, I think, is finding the passion that excites you and makes you want to get out of bed in the morning and save the world. Bryan, I think, offers a unique opportunity for students to actually experience the breadth of practical information and how it works. By working with industry leaders, by absorbing academic knowledge, by having practical experiences in the field, Bryan can expose you to the broad breadth of things that are going on in the information technology field. You can find what excites you and then pursue that passion. Intel has a great saying by one of our founders, Bob Noyce. Don't be encumbered by the past. Go out and do something wonderful.